Mississippi Department of Health reported over 2,200 new cases, and that brings the state total to 183,300 cases. 48 new deaths are being reported, and more than 4,200 people have died since the outbreak began. A former medical assistant and x-ray examiner with a clinic in Pike County has resigned from her position in fear her employer wasn't protecting them enough from being exposed to the coronavirus while on the job. 12 News' Alex Love spoke to her and was granted inside access to see how the facility is stocked.
After 4 months on the job, a healthcare worker felt she had to walk away from treating patients, accusing the Macomb Urgent Care Center of not providing staff enough PPE while testing people for COVID-19. At the end of the summer, Taryn McClernand moved her family all the way from Houston, Texas, to work the front lines helping patients at the Macomb Maxim Urgent Care Center.
We needed to take care of my husband's grandfather, and the cost of living here is cheaper, and I found a good job at the urgent care. Well, I thought it was a good job.
The center is one of the few and busiest rapid testing sites in all of Pike County. In the last couple months, McClernand claimed gloves were going scarce and higher-ups weren't helping.
They told us we were going through too many gloves and that we couldn't use gloves any longer to triage the patients, and we were only allowed to wear one glove when swabbing the actual patients. Lots of times when you're swabbed, you cough or you sneeze, actually letting out droplets we were then exposed to if we only got to wear one glove.
Last week, McClernand sent in this resignation letter explaining her daughter has severe asthma and her 93-year-old grandfather lives with them and is at extremely high risk. She refuses to put them at more risk and feels the company is putting dollars ahead of people.
I didn't feel too comfortable, to be perfectly honest with you. I figured that I'm going to die sooner or later, but I'd rather make it later.
After notifying the clinic about this situation, we were granted access inside to a storage closet with several glove boxes holding anywhere from 40 to 300 gloves, plus one in each room. Management claimed there's never been a shortage.
Everybody wears a mask, and then they put gloves on. If they swab, they have gloves on. If they're in patient contact, they have gloves on. No one's ever told us, you know, I'm the nurse practitioner, and I really encourage everyone to wear gloves.
The CDC states COVID-19 can transfer by landing on surfaces and someone touching it, then feeling their mouth, nose, or eyes. But the clinic stated McClernand never did rapid testing and mostly interacted with patients at the front desk.
I think maybe she was just a little disgruntled. She had been reprimanded for turning patients away. If someone comes in at 7:50, we're to see them. Can you say we're through seeing patients today? That's not our policy.
McClernand denied not being part of rapid testing, and even though this job was the family's only source of income, she still wants to dedicate her career in the medical field and is looking for a new job. The Macomb Urgent Care Center added once a month they do a deep COVID-19 cleaning across the entire office, also disinfecting every room when each patient finishes up. Reporting in Macomb, Alex Love, 12 News.
And we want to hear from you online. Does your workplace take enough precautions to protect you against COVID-19? You can share your thoughts on our WJTV Facebook page. Be sure to leave a comment below.